Greetings from the World Health Organization. My name is Chandra-Mouli, and I work for the Department of Reproductive Health and Research. In this brief presentation, I'd like to take you through the findings from two papers that we co-authored with collaborators from the Emory University and Center for Diseases Control in the USA. The papers are titled Help and Care Seeking for Sexually Transmitted Infections Among Youth in Low and Middle Income Countries and STI Services for Adolescents and Youth in Low and Middle Income Countries Perceived and Experienced Barriers to Accessing Care. The background to these papers is shown on this slide. So WHO estimates that there are 500 million new cases of curable sexually transmitted infections affecting adolescents and adults worldwide every year. Adolescents are disproportionately affected by these infections. There's very limited information available on what they do when they suspect or have a sexually transmitted infection. We know that they experience barriers, but we wanted to capture and understand how these barriers present and how they have evolved over time. A number of strategies have been published by WHO, including the Global Health Sector Strategy on Sexually Transmitted Infections. And this strategy clearly emphasizes the importance of addressing adolescents in the context of STI prevention and care. So in our two papers, these were the three research questions. Firstly, when young people in low and middle income countries have or suspect that they have an STI, what do they do and where do they go? To seek help or to seek care. Then in seeking appropriate care, what barriers do they experience? And thirdly, what are perspectives of both young people and providers about adolescents accessing care for sexual and reproductive health services with a particular focus on sexually transmitted infections. The methods used in our search are shown on this slide. The databases that we went into are listed there. The hand searches of the journals that we did in addition to looking at these databases, the journals that we looked for are listed there. The terms that we use for adolescents, for health service and access, for barriers, and for STI, STD specifically are listed on this slide. So we used a very carefully thought through approach to search for this information. And the methods that we use, we looked for papers published between 2001 and 2014, with a focus on young people's use and preferences, with a focus on low and middle income countries, papers published in English, and we appraised the quality of these papers using the criteria listed on this slide. And then we did a thematic analysis and synthesis to develop themes and codes. And then we grouped the codes and then used that to write up the papers. Now, there were two papers that were largely based on the same set of studies, and they're listed on this slide. There was a huge focus on papers from sub-Saharan Africa and from Asia and the Pacific. And the methods that these papers used are described here. Of course, because this was a review that only included papers in English, we did not find any papers from Latin America. But our sense is that there are not many papers from that part of the world. So these are our findings. Our findings are firstly, what do young people do and where do they go in terms of finding informal help, care, or treatment for STIs? One finding is that they don't seek treatment at all. Second is that they wait or delay treatment either because they don't understand what the situation is or because they have a number of concerns about seeking care. Self-treatment is another option. So these are huge issues in terms of what they do. Information sources are listed on this slide. Media, healthcare providers, peers, schools, parents, and organizations that work with young people. Information sources for STI, the preferred ones are health service providers and schools. And quite understandably, they avoid discussions with parents. So what do youth do, and where do they go in terms of finding informal help, care, or treatment? Public services, private services were infrequently mentioned in these studies. They afford confidentiality, but they are expensive. NGO-run clinics were mentioned. They're perceived as youth-friendly and confidential. Pharmacies are a very popular source. They're low cost, they assure confidentiality, and in many places you can obtain treatment even without any prescription. And then there are alternative care-seeking sources, looking for traditional healers and quacks. Clearly, the private sector is a very important source of care. The second is, what barriers do young people experience when they want to seek care for STIs? Firstly, availability. Either products or services are not available in many places, either for adolescents or for adults. Where services are available, they are not accessible. So adolescents are not able to obtain them. They are expensive, they have long waiting times, they open at hours which are not possible for adolescents to access. And so these are the whole set of barriers in terms of accessibility. Acceptability means services are available, they are accessible in the sense that adolescents can use them, but they don't want to. They don't want to because the providers belong to the opposite sex, and that's a problem as perceived by adolescents. They're worried about confidentiality. They don't believe that the providers have the necessary skills, and they are hugely concerned about the judgmental attitudes and behaviors of adolescents. So what are the young people's and providers' views about adolescent access? Young people talk about rude and unfriendly provider behavior, blaming, lecturing, scolding, yelling. NGOs or specific youth service facilities are perceived to be friendlier than public services. And confidentiality is a big problem. You have often other patients in the same hearing range. There's no visual privacy, no auditory privacy. Providers' perspectives, even providers acknowledge that providers' attitudes and barriers could be, behaviors could be a barrier. They acknowledge that their own attitudes and barriers. They're aware that societal taboos prevent care seeking, and they themselves say that when they see the adolescent in front of them, they adopt a parental role. And they also say that they don't have the communication skills to deal with adolescents. So finally, to conclude, there are 4 implications of this review. First is, young people in low and middle income countries are not seeking appropriate care in a timely manner. This has huge implications for their own health and for the transmission of STIs to others. The second point is, barriers such as confidentiality, cost, and stigma influence decisions about seeking care at all, whom to seek care from, where to seek care from, and when to seek care. So barriers are a huge issue. The third thing is, health workers, a trained, a capable, and a friendly health worker is key. High quality training, ongoing supportive supervision will ensure that these attributes can be developed in health workers. And lastly, we need to work with adolescents and young people to make services friendly and responsive as perceived by them. These are very important features, affordability and confidentiality. So that brings me to the end of my presentation. To wrap up, I'd like to make the point that there's a huge burden of sexually transmitted infections in adolescents in low and middle income countries. Adolescents have not been addressed systematically, and available services are not responsive to their needs. So adolescents around the world, especially in low and middle income countries, are doing whatever they can to seek information and care. We absolutely need to do much more than we are doing now. Thank you.